right, welcome back to Dr. Moses' YouTube channel. And on today's episode, we are going to dive into a myth. What is the real cause of your high blood pressure? Are you on 2 or 3 or even 4 blood pressure medications and you are still struggling to get your blood pressure down? In the previous episode, I showed you how to correctly measure your blood pressure, why most of the blood pressure readings in your doctor's office are wrong, and I showed you how to correctly measure your blood pressure. So if you not watched the video, go back and watch the video, because taking the readings into your doctor's office, measuring your blood pressure, the techniques that I showed you will automatically reduce the number of medication you are taking. So go back and watch the video. But on today, before we talk about the natural remedies to treating your high blood pressure, proven natural remedies, let's look at the cause, the real cause of your increased blood pressure. There is something called metabolic syndrome. If you've never heard it before, I'm going to explain what it is in a layman language so you can understand. Metabolic syndrome is one of the biggest things that are leading to insulin resistance and therefore causing high blood pressure. Metabolic syndrome, what it is. Number one, there are a constellation of symptoms that constitute metabolic syndrome. The first one is the pot belly, the abdominal obesity. Now, when you look around, anybody in the United States or across the world, almost about 95% of people has abdominal obesity. That means they have a pot belly or the beer belly that we see around. And so if you're a male and your waist circumference is over 40 inches, or you're a female and your waist circumference is over 35 inches, that is one of the signs of metabolic syndrome. The second sign of metabolic syndrome is when your triglycerides levels are over 150. The third sign of metabolic syndrome is when your good cholesterol or the HDL is less than 40 in male or is less than 50 in a female. The fourth sign of metabolic syndrome is when your fasting glucose is over 100 milligram/DL. And the fifth syndrome or sign of metabolic syndrome is when your blood pressure systolic is over 130 and the diastolic, the bottom number, is over 85. So if you have a constellation of the symptoms, you have what we call metabolic syndrome. And what metabolic syndrome actually leads to is the insulin resistance. The insulin resistance is where your body secretes insulin, but it's not able to utilize the insulin as the energy source of your body, and so your blood sugar goes high. And when there is an insulin resistance of your body, there is the risk of activation of a system we call RAS, RAAS. That is the renin angiotensin aldosterone system. This system is activated when you have insulin resistance. And what happens when this system is activated is that there's a substance in your body called renin. Renin is activated. When renin is activated, it causes a lot of problems. One of the problems it's going to cause the activation of the sympathetic nervous system, and therefore there is going to be a spasm of your vessels. Your blood vessels are going to clamp down. And when they clamp down, what it tells your body is that your blood pressure is low. And so this is what's going to happen. It's going to cause reabsorption of sodium. The kidneys are going to reabsorb sodium into the body. And when the sodium level is so high, it's going to retain a lot of fluid in the body. And that is the cause of the high blood pressure. That's one of the causes of the high blood pressure. Because of the activation of that system, there is going to be increase in the secretion of renin, and therefore there is a retention of sodium in your body, causing increased fluid retention and leading to what we call increased blood pressure. Another thing that insulin resistance does is that it impairs vasodilation. Because your vessels are not dilated, guess what? They are going to clamp down, okay? So because of that, you're going to cause increase in blood pressure. And another thing that happens is that there is what we call the endothelial dysfunction, where your vessels, your blood vessel, there's a dysfunction of that, and that is going to cause a closing of the blood vessel. And again, this leading to what? Sodium retention, a lot of fluid retention in your body, and your blood pressure is going to go very high. So as you can see, it's not the amount of salt you're eating, but it is that metabolic syndrome leading to insulin resistance, which is the biggest reason why most people have blood pressure problem today. I'm talking about primary hypertension. Now, there are other causes of hypertension we call secondary hypertension, which about 1 to 10% of blood pressure is caused by a reversible causes we call secondary hypertension. For example, if the arteries that go to your kidneys are very narrowed, we call that renal artery stenosis. That also can lead to high blood pressure, again, activating the RAAS system, which is the renin angiotensin aldosterone system we mentioned before, again, causing retention of sodium. It's reabsorption of sodium, and therefore causing what? Increased retention of fluid, and therefore you have high blood pressure. So this is one of the biggest reasons why people have high blood pressure, besides the secondary hypertension, which we'll mention in other videos. So if you are suffering from hypertension, it's not because of the salt you're eating and your doctors are telling you to cut back salt. That's not the real reason. So you have to tackle the reason why you are having high blood pressure. So on my next video, don't miss that video, because what I'm going to share with you is the two natural ways you can do to be able to reduce your blood pressure and to get off those blood pressure medications. So if you haven't helped with this information, I want you to share this video with your friends. Give me a like, subscribe to my channel. Now, next week, come back and I'm going to show you the two natural ways you can do, proven scientifically, long term, to be able to reduce your blood pressure. Until then, I say stay well.